looking at working on our leg and our thigh. We're going to use traditional deep tissue sculpting techniques. So if you have had self-massage before and used deep tissue, this will be a review. And if not, then this will be something new. Yay. Awesome. Do some deep breathing. Letting out some sighs. Getting our tools ready. So one of the things we can do to get our tools ready is to do a little tapping on the webbing. Good. A little tap, tap, tapping. Nice. Good. Another side. Good. Yeah, we definitely are doing self-massage, kind of traditional. So from the deep tissue sculpting self-massage that we learned in Essentials.
Okay.
So always good to get yourself centered. I know we did a nice centering this morning in Wisdom Circle, but let's take a moment to do some breathing and center ourselves, ground ourselves, prepare ourselves for working. So take a nice deep breath, let out a big sigh. And again. Perhaps roll your shoulders. First one direction, and then the other. And I really liked this when I was doing this today. So place your hands on your shoulders, bring elbows together, and then wrists together and down. Elbows together, wrists together, and down. One more. And then let's reverse it. So wrists together, elbows together, down. Wrists together, elbows together, down. One more. Wrists together, elbows together, down. And shake it all out. Nice. All right. So tools for today. Hopefully you've got short nails, because if you're going to use your finger pads or fingers, you want to have short nails. We don't want to do acupuncture today. So short nails, you should not be able to feel them when you go like this. So check your nails. If you don't want to use nails, knuckles make a great tool for this work. We're going to do at least one with soft fist. So soft fist or even these knuckles make good tools. The edge of the fingers, the pisiform or thenar eminence of the hand can make good tools, but probably you're going to use fingertips or knuckles. Thumbs, if you use them, be very cautious. Support them with the other fingers so that you don't put too much stress on the thumbs, okay? So, oh, we just got a message about audio, but I hope it's not for today. I don't see anyone else in our class today, so. All right, so we're gonna start on the leg. So I'm gonna review a little bit of anatomy. I'm gonna show it as I work on it. So I'm gonna turn this and turn it down and put my leg up here. You can see okay, yes? Purposely wore a short skirt that's got shorts underneath it so that you could get access to all the parts of the body. All right, so tibial tuberosity, tibia bone, deep tissue right on the bone, doesn't feel so good. So we're gonna work on the sides of that bone, not right on top of it. We're gonna define the leg with deep tissue sculpting on all four sides, okay? So we'll do each of the four quadrants. Now for deep tissue sculpting, just a reminder, we start at zero pressure, just resting our hand, the weight of our hand or our tool resting on the top of the skin, yes? And typically we're going to use our body weight to add pressure. So when we're sitting, we're going to push into our sit bones, growing our spine tall. Then we're going to shift that weight over and into our tool. Our tool only has enough tension in it to hold itself up. So we're not using muscle strength. We're just using enough to hold ourselves up as we lean our body weight in. We want to imagine the tissue like layers of an onion, and we're going to sink down layer by layer with a little bit more pressure. Remember, those layers are very thin if you can think of an onion. As we sink in through the skin, through the superficial fascia, through the muscle tissue, each muscle fiber, our goal is to seek the bone, but we may not sink that deep. So we're just going at whatever the body allows us to do. Once we've gotten to depth, what sometimes often happens is it feels like the tissue wants to pull us along in the direction of its fibers. So we're going to follow that. So these muscle fibers of the muscle, we're on the tibialis anterior, go straight down towards the foot. So as I lean my body weight in, the muscle wants to pull me along and I'm going to follow it. So this is called a compress. So that's the compression part. I've poured my weight in and follow. It's usually very, very slow. So you can see in the time I've been talking, I've moved maybe half an inch, not very far, and certainly not very quickly. So listen to your body. Self-massage is tricky because you're both the giver and the recipient. So pay attention to how does your body feel applying the pressure, making sure it's comfortable, and then how does your body feel receiving the pressure? Does it feel easy, comfortable? It always wants to stay in that pleasurable zone. We do not want to cause our own body pain or harm. So allow the muscle tissue to slowly melt, soften, lengthen. These are all signs that the tissue is opening and releasing and allowing a little more space in the body. So I'm slowly following this. I'm on the side of the bone in the soft tissue. Only enough pressure in my hand to hold myself up so that I don't collapse. And I'm working my way all the way down the length of that muscle. Now, when I get to the retinaculum above the ankle, I'm going to stop there. And I'm not going to just come out quickly. I've added some depth, so I'm going to slowly, gradually come out. Good. So typically when we're working with the deep tissue work, it's so nice to introduce our touch. So I demonstrated the technique and the use of a tool, but really before we work, we want to do something to warm the tissue up, to invite us in, to say, hi, we're going to be working here. So as you can see, I'm doing some gentle grasping. I'm just saying hello. You could also do some skin rolling, which we learned on the forearm when we did our forearm work. So this is where you take a fold of the skin, lift it towards the ceiling and roll it. You can also do a little skin shaking where you grasp a little bit and shake it, or even just some fascial stretching. So here I'm gently applying a little bit of pressure to the skin and putting my hands in opposite directions and just holding it gently. So just something to say hello, to invite us in, okay? So we're gonna continue with this and do a line down the medial aspect of the leg. So on the posterior aspect, we've got two muscles, gastrocnemius and soleus. On this medial aspect, we have some of soleus right here on the side here. So we're going to just shift our weight in. So I'm going to use the heel of my hand here. You could use soft fists, you could use knuckles, whatever seems like it feels comfortable to you. Sometimes using the palm of the hand gets sweaty and uncomfortable. So if you are sweaty, use the back of your hand. So again, no pressure. Start with that. Lean my body weight in to add pressure. And then slowly wait for the tissue to open and pull me along. Slowly wait for it to open and pull me along. Everybody's tissue is going to open at a different rate, at a different speed. So listen to your body. This is not a push it through kind of modality. This is a wait, be patient, and follow kind of modality. So for the end, I'm just going to switch tools so you can see a little bit better. And I'm just going to go down to the medial malleolus, which is right here, my ankle. Good. All right. So we did the medial aspect. We did the anterior aspect. And I'm going to turn my leg to the side so that I can do the lateral aspect. So on the lateral aspect, we have the peroneal muscles. Peroneus longus goes down the side underneath the foot, comes all the way over to this side of the arch, and peroneus brevis just comes to the base of the fifth metatarsal here. So these muscles will get a nice workout. Again, we can use soft fists, we can use knuckles, we can use heel of hand. I'm going to say probably we'll try knuckles for this one. So we are using different tools. So place the tool, no weight, it's just sitting there. Then let the weight of the tool be there. Start to add pressure by shifting the weight. So I'm pushing into my sit bones. If I were standing, I would pour the weight from my foot. Now, can you use a foam roller for some of this? Yes. Foam rollers are a way to apply deep tissue sculpting technique to the body. But what you really need to be mindful for with using a foam roller is how quickly that pressure is applied. So just as I sunk and melt very slowly into this, you want to sink and melt your body tissue over a foam roller. So if you let the full weight of your body be on it immediately, it's probably going to be painful. And what you want to do is not have your body go into that resistance of when it feels pain. Because when the body feels pain, it resists, and that's counterproductive if you're trying to get it to let go, right? Again, I'm going to change tools here so you can see a little better what I'm doing. So breathing into it, using the breath to help facilitate the opening, softening, releasing. If you get to a spot that's painful, pause, wait, be patient. Just being present with that spot, putting your attention on it, will allow it to relax and release. This is the same focus we use when we're doing stretching. We breathe into the stretch. If there's any places that are tight or sore or holding, we put our attention there. And just our attention and our breath helps the body to let go and release. So we've done 3 aspects of the leg now: the anterior, medial, and lateral aspect. Last aspect is the posterior aspect. So for this one, I'm going to suggest a soft fist, and depending on how you're sitting, either hand will work. And you're going to, again, shift your weight in. Let it sink and melt, and then slowly ooze down. I'm going to show you another way that you could possibly do this on the other leg. We'll do it this way for this leg. The body mechanics for self-massage are a little more difficult than when you're doing massage on someone else, especially when you're using a massage table and it's at your right height. You're on your feet and you can pour your weight a little more effectively. So if it was hard to get pressure because you felt like you weren't able to use your whole body weight for this, what you can do, and we'll start on the other leg and we'll start with the posterior aspect for this, is you can turn the leg this way and lean in that way. And hopefully that's a little easier. Let me turn that down just a smidge. There we go. So again, shift the weight, soft tool, and then slowly melt down the length of the muscle. You want it to pull you. It's almost like you're following a zipper that's opening. You're not pushing the zipper open, you're following it as it opens. It's a very different sensation. If you come across a tender spot, you pause, you wait. Let it soften, let it melt with your breath and your attention. And the name deep tissue is sometimes a little hard to understand because you think that means you've got to be in really far, physical depth. But if you're connected into the fascia of that muscle, I'm using a different tool here. Now I stood up to do that technique. I've got my foot up on the edge of a chair, and that's helping me have better leverage than it was when I was sitting. So that may be an option for you to work this area. So we're going to go ahead and work the peroneals on the other leg, the lateral portion. Again, you can use heel of hand, fingertips, knuckles. I would probably not use thumb. All right, so fingertips, sinking and melting in, breathing. Just going to that edge between pleasure and pain. Staying on the pleasure side of it, not going into the pain side. Why? We want to avoid resistance. We want the body to welcome us, to say, oh, yeah, that feels so good. Not, what do you think you're doing? That's too hard. That's painful. I hurt. No, we want to stay in the pleasure side. We want to be welcomed by the body. We want to allow the opening, softening, spreading to happen. Now, some areas are less dense, and you may feel like you got kind of kicked out a few layers. That's okay. Just stay with the tissue, stay with your line, all right? So what we didn't do on this leg, since I was showing a technique, was we didn't kind of wake it up and say, hello, we're going to work here. So if you want to work the front, I definitely noticed the difference on the side from not having done that. So fascial stretching, some grasping, just warming up that tissue. All right, next aspect is going to be right next to the bone on the tibialis anterior muscle. So sinking and melting. Going to use a couple fingertips against each other, supporting each other. Breathing, putting your attention there. Good. All right. That was a little quick. Last aspect is our medial aspect. So again, heel of hand or fingertips or knuckles. And I'm not forcing strength, I'm placing it, I'm leaning my weight onto it. So there's a big difference. Using your body mechanics, using your body weight, there's usually less resistance when we do it that way. Again, when we use our arm strength, when we use our physical strength, that's when the body will resist. That's when the body says, wait, that hurts, that's painful. So we avoid doing that and we just follow along, letting the body determine the speed and pace. Nice. All right. So we've worked all the aspects of the leg. I'm going to invite you to just do a little bit of palpation around the knee. So the patella is the kneecap, and it's a floating bone. It's floating in the tendon from the quadriceps up here, from the quadriceps. So it's pretty thick quadriceps here. It narrows. It's reinforced, if you will, from this patella, and then it attaches right here on the tibial tuberosity. Okay, so palpate around the knee a little bit. Just get a feel for it. We're not going to do any sculpting in the knee, but you can get a feel and say hello to the knee. You can circle it a little bit, one direction and the other. All right, we are again going to work the aspects of the thigh, same way we did the aspects of the leg. We're going to do 4 passes into each of these quadrants. So we'll do right on top of the quadriceps, we're going to get rectus femoris. We're going to go on the side, getting some of the vastus lateralis as well as the iliotibial tract. We're going to go underneath and get hamstrings, and then we'll go on the medial aspect and get the adductors. So probably the easiest tool here is, if you're sitting up tall, would be to use your soft fist or your palm. If you want to not sit up tall, you can bend the knee. Let me bring this up a little so we can see what we're doing. There we go. And you may want to actually use your forearm. So you can place the forearm here and then again lean your weight onto it. That may be the easiest thing to do. So gradually increasing the pressure by increasing your lean, your body weight lean onto it. Good. Now, to follow, you definitely need to be behind your tool. So if you're right on top of it, because we're so close to it, you may be right on top of it. You may need to tuck your tail a little bit, sit back, so that you have a place to follow from. Again, I'm not pushing or forcing, I'm following. Big, thick muscle. Powerful quadriceps muscle. It may feel like you're not going anywhere, and that's okay. Just add a little bit more weight up to your comfort level, and then slowly follow it along the length of the muscle. The deep tissue sculpting technique developed by Carol Osborne. You can take her training in her classes. And with that work, you always are going in the same direction as the muscle fibers. So this is not a kind of cross fiber technique. It is intended to follow the opening of the muscle along the same line as the muscle fibers. So really important to know your anatomy. Where does that muscle start? Where does that muscle end? What direction do the fibers go in so that you can follow in that same line? Okay, I'm getting very close to the end here. I'm going to pause right above the kneecap, and then I'm going to slowly come out. Good. All right. So we did rectus femoris. For the side here, I invite you to turn onto your side a little bit. You can use heel of hand, you can use soft fist. Probably forearm's not going to feel too comfortable here. You're not going to have enough leverage to lean onto it. So sink and melt. Now, the iliotibial tract is not muscle. It is a dense band of fascia, thickened connective tissue. It is not going to melt the same. It's not going to feel the same as that muscle we just worked on. Still okay. You're going to feel it start to release and relax and lengthen, but it's going to feel different. So just be patient with it. Breathe into it, feel it. Again, you get to a tender spot, a sore spot, pause, hang out, wait, be present with it. Put your attention there. Pain is the body's signal. Listen to me. Feel me, hear me, be present with me. It's a wake-up call for us. When we feel pain, it's our body's way of communicating something is not right there. So be with it. See what its message is calling to you. And breathe into it. Use your breath. If you feel this anywhere else, if you're feeling it in your shoulder, in your back, see if you can engage your serratus anterior. That is the muscle on the side that holds your shoulder blade against your rib cage. It helps to stabilize so that you aren't muscling, but that you're able to hold the position with your body weight and lean in. Nice. Right when you get to the edge here where the crease starts, you can just release and relax that. All right, for underneath, really hard to get to, I'm going to encourage you to have a hard surface, and you're going to use a soft fist, and we're going to do a series of compressions rather than a compress and follow, okay? So fist up or down, whatever feels comfortable, and you're just going to basically let the weight, this is very similar to using a foam roller, let the weight gradually melt around the fist or around your tool. Breathe into it. Typically, the tissue when we're doing a compression like this takes about 30 seconds to a minute to fully release and relax. So this is similar to doing any kind of yoga stretches. It takes a little while for the message to get through. And then you can slowly ease off of that and then move your tool down to another place and let the weight gradually come down on it. Breathing into it. When you can fully let the weight be there, I've got to actually move my cushion so it's supporting my tool. There we go. And you can release and relax and let it go. I'm actually going to grab a foam roller so I can show you how to do that with a foam roller. Hamstrings is probably the easiest one to do that with. So I've got my foam roller and I'm going to place my tool. I'm supporting with my other leg so all the weight's not on it at first. And I gradually let the weight go down against the foam roller. And when this muscle can relax over the roller, then I can take the weight out of here so that it doesn't hurt at all. Same thing, I can move the foam roller down, slowly ease the weight onto it. Let it sink and melt. As long as it's comfortable, I can add more weight. So this is using the foam roller to do a compression, deep tissue sculpting compression. I come out of it nice and slowly before I move the foam roller out of the way. All right, we got one last spot to do, and that's a little lower down. So I'm going to use my soft fist. I'm going to slowly ease the weight of my leg or thigh down onto it. I can come up a little bit, lean more weight on, breathe. And then slowly ease off of it. Good. Another way that you could do this is to do a compression down or even up if you wanted to. So, see if I can get some support here for this. So I'm going to say, let's go up. So starting near the bottom of the hamstrings. So how do I lean into this? I'm hooking my fingers, letting them sink and melt by leaning down against them with my body weight, bending my knee more. And then I'm shifting my weight back and letting my fingers ooze through that muscle tissue up toward my sit bone, toward my ischial tuberosity, which is where these hamstrings attach. One thing about this deep tissue work is it's slow. It takes a long time. So I know I'm recognizing that we're already at half an hour. If you have a few more minutes, we can do the other aspects of this other thigh. You want to go all the way up to your sit bones, your ischial tuberosities, and then you can slowly come out. Okay? Good. So if you're hanging around, we'll go ahead and do the medial thigh. This is where the adductor muscles are. Sinking and melting in. I'm using my soft fist here. Waiting for the tissue to draw me along. When I get to the crease there, I stop. All right. So now we're on to this other thigh. I'm going to use a little bit more of a long leg. And I'm going to lean in with the heel of hand this time. Sinking and melting. Relax the fingers. Just trying to give you a good view if possible. My whole muscle just went clunk. So signs of tissue release. Sometimes you'll feel it get warm, like heat being released. Sometimes it just feels like it softens and spreads, like melting butter. You might feel it lengthen, like a rubber band stretching. You might get some other sensations either underneath your tool or in another part of the body, like some little twitching. So my knee is doing a little twitching. I don't know if you can see that happening right now as I'm working on the quadriceps. That tendon is going, whew, that's interesting. Got some stuff going on there. So twitching. Sometimes you'll feel it in a whole other part of the body. You might feel it in the toe or the fingers or the shoulders. Sometimes you'll hear some sounds the body's making, like the stomach will start to gurgle. Or maybe you'll have the desire to belch or fart. Those are all signs of tissue release, or cough or sneeze or laugh or cry. All signs that something good is happening because you're being present and listening to your body. And that's really what this deep tissue work is all about, giving yourself a focal point to connect in and listen to your body. All right, we've done 3 aspects. Last aspect is the lateral aspect where the iliotibial tract is. We'll use fingertips for this. Breathing, sinking, melting. So again, my ischial tuberosity and my foot on the floor are pushing down. It's enabling my body weight to come up and over and into my tool. It's not the most ideal body mechanics, but it's what I need to do to work on myself when I don't have the ability to have somebody else work on me on a massage table. Breathing. So I feel a little tenderness right there. It's not painful. It's still in the pleasure zone. But I'm going to pause and wait for that little bit of sensation, slight discomfort to melt away. And then I'm going to continue on. It always gives way. Sometimes I need to be patient longer than I realize. And I want to just listen to my body. Excellent. Whew, good. So we did all 4 aspects of both legs and thighs. Hopefully that feels good for you. I'm going to invite you to stand up and feel your legs. Feel your connection to the earth. How's that feel?
Feels good.
Awesome. Great. So this is a great way if you're feeling a lot of tension. Perhaps you've gone on a hike, you've used your legs a lot, you've been walking a lot, standing a lot, to really help get the blood flow and circulation, as well as elongate and stretch the fascia surrounding those muscles. So other things you can do now that you've done this is you can take some lotion or oil and just kind of rub it over the legs and get that circulation moving around. You can take a hot Epsom salts bath and soak the legs. That's a great pain reliever to soak in Epsom salts. All of those things can help enliven and invigorate and heal your legs and thighs and help them feel energized again. Sound good?
Uh-huh, yes.
Awesome. Any
Okay.
questions about what we did, how we did it? That seem
That
like a
was,
review for
thank
you?
you. No, thank you. It was good
Yeah,
to
you're
watch
welcome.
you. Okay.
So